small and rural hospitals tend to be in agricultural communities, and our payer mix is often predominantly Medicare, Medicaid, and uninsured. For ourselves, for example, that's 75% of our business. And so we have the challenge of capital formation that bigger, more profitable areas of the country don't have. So that's a bit of a challenge. I think the other one that's more important, though, is just the scale. And information technology, as it's emerging, requires a lot of technical expertise and a lot of system expertise that in a small rural hospital you're just not going to be able to afford. At San Luis Valley Regional Medical Center, we're like a slightly bigger small rural hospital. We're a PPS hospital. And we had a department of 8 or 9 people, which is, for example, the other critical access hospital we have has 1 person in IT. And so you can imagine those challenges. What we decided was that we really had no business being in IT alone in the long run. That we couldn't afford a third of a database administrator. We couldn't afford a half of a technical expert in another area. So we made the decision that we're going to end up needing to partner with someone. And we actually looked at partnering with the tertiary care facility that we're an affiliation, we have an affiliation agreement with. And ultimately we decided to partner with CareTech because they have a broader portfolio of services that we can't afford to have individually, but we can afford to work with them for pieces of that. And so it gave us a much greater exposure to technical IT skills, strategic IT skills, planning, frankly, what's happening out in the industry. And we didn't have to pay for it in single chunks, and worked out great.